Thank you very much, Madam Speaker. I rise tonight to speak firstly about the Mersey Community Hospital and to reflect on a recent visit that I attended across the hospital campus with our Shadow Health Minister, Sarah Lovell, and I wanted to place on the record my sincere thanks and acknowledgement of the hard work of the staff at the Mersey Community Hospital, particularly over the course of the last few months with obviously the COVID-19 outbreak in the northwest and the particular pressure that put on that hospital facility with our other two major hospitals in the region being closed at that time. And I was really impressed by the measures that they've put in place around their response to COVID and changes in practices and the like. And I wanted to extend my thanks for the generosity of their time for providing that tour also. And I also wanted to mention those representatives from HACSU whom we met with afterwards, just to thank them for sharing their experiences as well, particularly around some of the pressures of working in the accident emergency department currently and the pressures there around changes in operating hours, which we have provided some advocacy around. So I really wanted to thank the staff for their ongoing work, but also to reflect on the tremendous contribution that they made to the health and wellbeing of the people of the North West Coast and continue to do so, but more particularly during the COVID-19 outbreak. I think many community organisations, Madam Speaker, in my experience, have stepped up and changed the way that they do things a little bit to support their volunteers, to support their communities. And I wanted to just reflect on two community organisations whom I've had recent contact with. And the first is Grow, Gather, Give, who operate out of Burnie High School. They have the school farm there, and I was fortunate enough to work with them to provide some home delivery services around baskets for emergency food relief for local families. And I really enjoyed the opportunity to do that. And, you know, I think for us during COVID it was, we were very, very busy and answering a lot of questions over the phone or, Zoom meetings and the like, but there's nothing better, I don't think, than getting out and doing something practical in your local community at a time like that to assist. And so I really welcome the opportunity to work with them and provide that service, and I enjoyed the conversations that I had with people on their front doorsteps, and for them it was nice just to have a chat with someone from a distance. And, I really got a good and clear picture of the important work that Grow, Gather, Give are doing in our community, and I wanted to thank them and congratulate them for that. The other organisation that I wanted to mention, in particular around their response to COVID-19, was the Devonport RSL. And recently I met with Bianca Jubb, who is the coordinator there, and learnt more about the great programs that they've been providing out of the RSL in a time of need, not only for their veteran community but for others in the community as well. And they've been providing the simple gesture of a roast meal for people, something that when you live on your own sometimes you don't often enjoy because you might find yourself eating it for a week. It's something that typically a family would enjoy together, and so they thought that they were inviting people in to have a roast lunch together, but also delivering roasts out into the community as well. They had a cupcake drive as well, just offering someone a little bit of brightness in their day and providing cupcakes to the local community. And they're doing a number of veteran welfare programs out of the RSL there in Devonport, and it's just wonderful to see a local RSL club that's reinventing itself, providing invaluable services to the local community, and and not just providing those services to the veteran community, they're extending out into the local community and providing a valuable service. So that concludes my contribution. Thank you, Madam Speaker.
Thank you. Whoa, that was